Dr. Bloomberg was born on the 28th of July. Do you know what he is famous for? He discovered the virus Hepatitis B, which causes serum hepatitis, when he was working with Australian Aborigines way back in 1967. He was awarded the Nobel Prize in Medicine much later. And as a tribute to this Nobel laureate, 28th of July every year is celebrated as the World Hepatitis Day. Now let us look at the magnitude of his discovery. We know now by statistics, 1 in 20 people worldwide are suffering from some aspects of hepatitis B. In terms of millions, it is 370 million people in the world every year have got hepatitis B in some form or the other. Hepatitis B kills 700,000 to 1 million people every year, and it is one of the commonest causes of liver cancer. And as a result, this is a preventable disease, and therefore, as a tribute to Dr. Bloomberg, vaccination and prevention is absolute paramount importance. What does hepatitis B do to the liver? It produces acute hepatitis, which means the patient can develop jaundice. But that is in a minority of individuals. Everything depends upon the age at which the disease is acquired. For example, if you get the infection in infancy or childhood, there is an 85% chance that it will be persistent, meaning that the virus can stay in your body for life and devastate and produce liver disease. On the other hand, if you acquire the infection in adulthood, there is only a 15% chance that it can persist in the body and produce the ravages of the disease. Therefore, it is very important that we prevent the infection from entering the body at any point of time. In India, about 43 to 45 million people carry the virus, which is about 5% of the population. These people not only suffer from the disease, but also are capable of spreading the disease to their family, friends, and relatives. Do you know that majority of people do not even know that they have hepatitis B because it is extremely silent? They simply carry the virus. They are discovered incidentally when they go for a blood transfusion. They donate blood and they find that they have got the virus in the body. They go for a master health checkup and they find that they've got the virus in the body. And therefore, these people with hepatitis B apparently look very healthy. And therefore, they are all called healthy carriers. Now, let us for a moment look at how the virus enters the body and how you can acquire the infection. First, vertical transmission. What does vertical transmission mean? It means that from the mother, who is a pregnant lady at the time, they can acquire the infection during pregnancy at the time of birth. This is called vertical transmission. Vertical transmission is from the mother to the offspring. This can easily be prevented by immunizing the child at birth, which we'll come to a little later. Second is the horizontal mode of transmission. Now, this is very important. Horizontal mode of transmission occurs when you get blood or blood products during hospitalization, or if you get a needle stick injury from an infected person through the hypodermic needles. You must be very careful when you tattoo your skin or do skin piercing because the infected needles can transmit the infection. If you have IV drug abuse, this happens in some parts of India, especially Northeast, please say no to drugs because sharing of needles during IV drug abuse is a very important cause of transmission of hepatitis B and C. And these are the horizontal modes of transmission that you know of. Sexual mode of transmission, especially men having sex with men, is another mode of transmission. So these are the causes by which hepatitis B can sometimes come into the body. The symptoms are so silent, like loss of appetite, fatigue, a little bit of fever, that most of the time we don't even realize that hepatitis B is present in the body. And therefore, it is very important that we do serial testing or screening for hepatitis B as a mode to detect the infection very early. When the patient develops jaundice or accumulation of fluid in the legs and abdomen, it is a late part of the disease, and therefore these are symptoms which need to be looked into for prevention. Hepatitis, therefore, can lead on to irreversible chronicity, leading to a disease called cirrhosis of the liver, which is irreversible. And it is one of the commonest causes of liver cancer in our country. 60 to 80% of liver cancers are due to hepatitis B. The time taken For hepatitis B to produce this devastation, approximately takes about a decade, and therefore it takes about nearly 5 to 10 years before it can completely destroy the liver, produce cirrhosis liver or liver cancer. Because the virus is extremely silent and almost asymptomatic for a very long period of time, it is essential that we do testing, serial surveillance, and that is the only method by which we can prevent hepatitis B. Now let us see how we can prevent hepatitis B. Hepatitis B can easily be prevented by vaccination. There is a universal vaccination program that has been adopted by almost all the countries in the world, where at birth, the hepatitis B vaccination is part of the universal immunization program. You need to give 3 doses of the vaccine, and once you take all the 3 doses, you can be rest assured that for the rest of your life, hepatitis B will not affect you. It is very important that if you have not been vaccinated so far, the first thing you do as a tribute to Dr. Bloomberg is to get yourself vaccinated today. The first dose of the vaccine should go to you today, followed by the second dose, which is about 30 days later, and the third dose 180 days or 6 months later. If you take these 3 doses, you can be rest assured that hepatitis B will not affect you, and your duty does not end there. Your duty is to tell your friends, relatives, and everyone concerned to see that hepatitis B is completely eradicated from the world. They had attempted to do that, and please remember, we are now smallpox free. Let us make planet Earth hepatitis B free. While we understand how hepatitis is spread by vertical transmission, horizontal transmission, IV drug abuse, tattooing of skin, etc., hepatitis B is not spread by sharing of food or water, tears, sweat, urine or stool, kissing and hugging, coughing or sneezing, breastfeeding, or mosquito bites. One need not shun hepatitis B.